It's a topic that'll move you to tears.
What child, what adult, could hold their breath for 5 minutes and 21 seconds?
You know, I gave up something that I loved, and that was having the store. But the love you have for your daughter, your family's that much bigger. No one else was going to take care of her.
Yet, it's a crisis many California families are not even aware of.
My district has one full-time credentialed school nurse for 14,800 kids.
What do nurses do?
Help people and save people.
We do. We try to help people.
The school nursing shortage in our region is in critical condition.
I had some pretty bad asthma, like I had swelling up in my chest, and I had to sit out, and I couldn't talk to any school nurse because I didn't know if there was any school nurse that was around.
My biggest fear is that somebody was going to die. That's my biggest fear. And it's probably happened already.
I wish I could do more, because when they give you a hug or they make a little drawing with a Band-Aid on it and say, "Thanks, Nurse Vicki. You've made a difference. You've touched somebody's life."
Our daughter was a totally healthy, happy child until October '04. She was about 2.5 years old and began having uncontrolled seizures.
Pat DiLorenzo's daughter, Gianna, has epilepsy. Each month, she has 15 to 30 seizures. And her seizures can strike anytime, anywhere, even at school.
The second day of school, Wednesday, September 9th, the principal called us. Gianna had had what we were told was a 70-second seizure, was turning blue and foaming at the mouth. Paramedics were there. I was furious. My daughter is in a school with no protection. I demanded, and I got a copy of the paramedics report, which showed that it was 5 minutes and 21 seconds from the time the alarm came in to 911 dispatch to the time the paramedics arrived at school. What child, what adult, could hold their breath for 5 minutes and 21 seconds?
It's a heartbreaking story, but unfortunately, the DiLorenzos are not the only parents who have a child with a serious medical condition. Stories like this one are echoed throughout California.
The nursing shortage in California schools is critical. Between 10 and 20% of the children in our schools have some sort of a healthcare need that needs to be met daily.
California has 6.3 million students. And with chronic illnesses such as asthma, diabetes, childhood obesity, epilepsy, food allergies, and heart disease on the rise, there is concern over who will care for these students at school.
Kids spend most of their day at school, so there's just statistically there's going to be a chance that something will happen at school. And there isn't anybody around who wants, a dead child on the conscience, of any administrator.
Because there's no requirement in California for school nurses, school districts decide how many or how few school nurses they're going to hire.
We know that we need to do a much better job when our basic core function is keep our students healthy and safe while at school. We simply cannot shortchange those areas.
Each new day brings rising concern for Vicki Delaflante.
I don't think the public is aware of what a school nurse does or is. They see health office, they see nurse's office, and they don't understand that's not a nurse that may be sitting in there. If they're lucky, it may be a health assistant. Hey, Janine.
Hey, girl, how you doing?
Good, good. Hey, I was going to see if you could call Ricky and I could...
Vicki is a school nurse for the Natomas Unified School District in Sacramento. She, along with 2 other part-time nurses, provide the only licensed health care for the more than 12,000 students in their district.
Oh,